Hello everyone. My thesis is on the nursing shortage and how it negatively impacts the quality of patient care due to high nurse-to-patient ratios. In the U.S., nurses make up the single largest health workforce. They perform a wide array of patient care duties and are imperative to the delivery of healthcare services across various settings. The aging of nurses, the general workforce shortages in ancillary professions and support labor, and the global nature of this shortage are the key differentiators from the previous two shortages. This leads to my thesis statement. Due to higher patient-to-nurse ratios, the nursing shortage negatively impacts the quality of care for patients. In return, this causes more burnout, heavier workloads, more infectious diseases, higher readmission rates, job dissatisfaction, higher risks of medication and safety errors, and adverse health outcomes for patients as well as nurses. Ultimately, minimum staffing regulations, ongoing long-term workforce planning, implementation strategies for retaining nurses, technological advancements to increase the nursing workforce, and advocacy for increasing the nursing education funding are all measures that can be taken to help resolve the nursing shortage crisis. So a little bit of history on the nursing shortage. The current nursing shortage that the U.S. is faced with is not a new problem, and it dates as far back as 1964 when the Nursing Student Loan Program under Title VIII of the Public Health Service Act first began as an attempt to entice students into nursing to solve the same problem at that time. So in 1965, the ANA, American Nurses Association, wrote its first position paper on education for nurses. At that time, up to 85% of nurses in the United States were educated in hospital-based diploma programs. The 1965 ANA document promoted change in entry-level nursing practice educational requirements. At that time, hospital-based nursing education programs provided a cheap supply of student nurses to staff hospital wards. Student nurse programs were focused almost exclusively on meeting the staffing needs of hospitals. Nursing students were required to spend 24 to 30 hours a week meeting heavy demands on hospital wards instead of studying. Student nurses staffed the wards for free in exchange for their diplomas after about 3 years of service. So in 1983, government policy applied additional pressure to the demand side of nursing when legislation changed the Medicare reimbursement formula from a fee-for-service system to a system based on diagnostic categories. Although patient length of stay decreased and beds were closed, the intensity of nursing care, technology, and paperwork increased, as so did the demand for nurses. Simultaneously, the supply of nurses decreased as all nursing programs showed declines in enrollment because nursing was judged to be too demanding, too undervalued, and too unrewarding. In the mid-1980s, supply and demand for nurses were relatively balanced, and from 1990 to 1992, there was a slight surplus of nurses. So the current state of the nursing shortage has been characterized as being unlike those experienced in the past. Trends of an aging registered nurse workforce and limited supply to fill the impending vacancies are some of the unique aspects that bring a new dimension to an old problem. The causes for the nursing shortage include nurse short staffing, an aging workforce, poor work conditions, deficient resources for nursing research, growing career options for women, complex healthcare and technology, and rapidly aging populations in developing nations. Generally speaking, the current nursing shortage is a global public health crisis. So as a result of the nursing shortage, high patient-to-nurse ratios have been the most crucial issue facing healthcare organizations in the U.S. Consequently, these high patient-to-nurse ratios result in poor quality of care for patients, adverse patient outcomes, heavy workloads, stress, fatigue, burnout, job dissatisfaction, safety concerns, and increase in medical errors. Effects of the nursing shortage on patients. Typically, the nurse's capability to provide safe and quality care for the patient becomes jeopardized when there's a high patient-to-nurse ratio. So the risks for patients are urinary tract infections, pneumonia, upper gastrointestinal bleeding, shock, longer hospital stays, failure to rescue, 30-day mortality, and injuries. So the Agency for Healthcare Research and Quality funded an evidence-based practice center that involved a report including 5 studies that examined the relationship between the adverse patient outcomes and hospital nurse staffing. So the largest of these studies on nurse staffing examined the records of 5 million medical patients and 1.1 million surgical patients who had been treated at 799 hospitals during 2003. So according to the study, and according to the table below, there were higher rates of RN staffing that were associated with an overall 4 to 12% reduction in adverse outcomes depending on the outcome. Also, higher staffing at all levels of nursing was associated with an overall 4 to 25% reduction in adverse outcomes depending on the outcome. So, effects of the nursing shortage on nurses. Unfortunately, nurses' health is being seriously affected when working long hours and with inadequate staffing levels. In return, this increases the risk of musculoskeletal disorders, cardiovascular diseases, hypertension, and depression. And the nurses who experience heavier workloads are due to inadequate supply of nurses, increase in demand for nurses, reduction in staffing, increase in overtime, reduction in patient length of stay, and an aging population. According to a study in the Journal of the American Medical Association, each additional patient over 4 per nurse carries a 23% risk of increased burnout and a 15% decrease in job satisfaction. In August 2012, approximately 1/3 of nurses reported an emotional exhaustion score of 27 out of 30, considered by medical standards to be high burnout. Heavy nursing workload increases burnout and job dissatisfaction, which in return contributes to high nurse turnover. Nurse turnover simply means that any nurse leaving your organization, this includes involuntarily or voluntarily leaving. So, effects of the nursing shortage on healthcare costs. A number of national studies have estimated that the average cost of replacing an RN ranges from $22,000 to over $64,000. These figures include termination costs, costs of unfilled positions, advertising and recruiting costs, new staff hiring costs, and new staff training and orientation costs. The average hospital is estimated to lose about $300,000 per year for each percentage point of annual nurse turnover. As the average hospital RN turnover rate is 16.4%, hospitals will pay nearly $5 million per year in costs associated with nurse turnover. Implementation of a legislative model will help set basic staffing standards and encourage transparency of action through public reporting and imposing penalties on institutions that fail to comply with minimal standards. It is crucial for healthcare organizations to focus on ensuring safe and quality patient care, as well as improve job satisfaction by enforcing an optimal and adequate nurse-to-patient ratio and creating innovative and long-term strategies through a collaborative effort. Safe staffing ratios are necessary. They involve a lower number of patients per nurse. So some case studies, I'm not going to read them all, but in 2004, California became the first state to implement minimum nurse-to-patient staffing ratios, designed to improve patient care and nurse retention. The results, nurses gained more time to give to each patient and had more time to take occasional breaks. Procedural mistakes declined and fewer patients got sick. There was a study, a Journal of Hospital Medicine study, found that hospitals with a higher proportion of Medicaid and uninsured patients were significantly more likely to be above nurse-to-patient ratios than hospitals with low proportions of Medicaid patients. Safe staffing improves nurse performance and patient mortality rates, reduces turnover rates, staffing costs, and liability. A study involving the effect of increased nursing staff on the hospital's costs reported that increased nurse staffing did indeed increase operational costs for hospitals. However, it did not decrease the hospital's overall profitability. So, other solutions include ongoing long-term workforce planning, institution of an education and practice system to promote more equitable compensation in the healthcare community based on a better understanding of the educational preparation required for different healthcare roles, implementation of specific strategies to retain experienced nurses, and advocacy for nursing education funding. Solutions to increase nurses include generating awareness and helping others to better understand the educational preparation that is required for various healthcare roles by instituting an education and practice system to promote more equitable compensation in the healthcare community. Supporting healthcare employers to create and sustain programs that involve staff development and continued learning education. Also promoting recruitment of a younger, more diverse generation through counselors, youth organizations, schools, and other outlets. Introducing a more flexible schedule for nurses, implementing a rewards program or an incentive program to experienced nurses for serving as members and preceptors for new RNs, implementing appropriate salary and benefit programs, creating a partnership environment that advances the practice of nursing by establishing appropriate management structures within the healthcare system, ensuring adequate nurse staffing, providing nurses with sufficient autonomy over their practice in all settings, and redesigning work to enable an aging workforce to remain active in direct care roles. Ultimately, it is the long-term solution of changing the work environment and making the profession a desirable career choice that is essential. The positive news is that nursing continues to be the most trusted and respected of all the healthcare professions. From a demand perspective, it is one of the fastest growing professions and thus offers a strong career opportunity for today's youth. Nurses must use their voice to reach out to the healthcare system leaders, the public, and their communities, and the government in order to help create a more solid platform for change and inspire young individuals to become a part of the future profession of nursing. Thank you.